It was 2:41 in the morning when Leonard, 72, tried to stand up from his bed. Just moments earlier, he had been sleeping peacefully, unaware of the silent storm forming inside his body. There was no chest pain to warn him. No charpedage. No spinning room. Only a quiet shift of his legs over the edge of the bed, a brief push with his arms, and then the sudden loss of control. His knees buckled. His balance vanished. By the time his wife reached him, one side of his face had gone slack, his words tangled into strange sounds, and his right arm no longer answered his commands. In the hospital, doctors confirmed the truth no one had expected. A massive stroke had already begun forming in the short moments after he stood. Leonard had gone to bed the same way he had for years. Nothing about that night felt unusual. Nothing felt dangereux. And yet, by morning, his life had changed forever. What makes cases like his so unsettling is how ordinary they seem at first. There is no dramatic crash. No loud warning. Only a quiet chain of events that unfolds while the home is dark and still. What if the same nighttime routine Leonard followed for decades is quietly being repeated right now by millions of seniors across the world? What if that routine is interacting with aging blood vessels in a way that most people have never been warned about? In this video, you'll learn how that risk builds while you sleep, why the aging brain becomes far more vulnerable in the early morning hours, and why what feels harmless can sometimes be the final nudge toward disaster. Stroke almost never announces itself with force at the beginning. It begins subtly. A fleeting tingling in the hand. A brief stumble. A sentence that comes out slightly slurred. Many seniors brush off these early signs as fatigue, low blood sugar, or simple clumsiness. But for older adults, those brief moments are often the last quiet signals before permanent damage begins. After age 65, the odds change dramatically. National health data consistently show that nearly 3 out of every 4 strokes occur in this age group. That statistic alone should demand attention. Yet most seniors are never told how powerfully the nighttime hours influence that risk. Sleep is often viewed as a time of safety. A time when the body is resting and recovering. For the aging cardiovascular system, however, sleep can also become a period of hidden vulnerability. As the years pass, blood vessels lose their youthful flexibility. Their walls thicken. Fatty deposits slowly narrow the passageways that once delivered oxygen-rich blood to the brain with ease. The heart must work harder to push blood through stiffer channels. Pressure becomes less predictable. Oxygen delivery becomes more sensitive to even slight disruptions. The brain, which depends on steady circulation second by second, begins to operate with less margin for error. Yet despite these gradual changes, there remains one nightly habit most seniors continue without hesitation. Many were taught it was beneficial. Some were warned never to skip it. What few were ever told is how differently the aging body responds to that habit after dark. The danger does not arrive suddenly. It gathers quietly, night after night, until one ordinary moment becomes a medical emergency. In the minutes ahead, that habit will be revealed, along with why age transforms its effects, and how simple awareness can become the first line of defense against a life-altering stroke. Emergency room doctors notice patterns long before the public ever becomes aware of them. After treating thousands of critical cases, certain situations begin to repeat themselves with chilling consistency. Dr. Evan Mallory, a retired emergency physician who spent over 30 years on trauma floors, observed that a surprising number of strokes in older adults shared the same quiet setup. These patients were not neglecting their health. They were not ignoring medical advice. Many were disciplined, routine-driven, and careful. What placed them at risk was not recklessness, but the collision between well-intended habits and the hidden limitations of the aging body. One routine in particular stood out. It was not something typically associated with danger. In fact, most seniors believed it was a responsible, even protective behavior. Many had been repeating it for decades. Some had been told they must never skip it. That sense of safety is exactly what allowed the risk to grow undetected. When a habit feels beneficial, it becomes automatic. It is no longer questioned. It simply becomes part of the nighttime routine. That habit is drinking a full glass of water right before going to sleep. Water is vital to survival at every age. It keeps blood from becoming sluggish, supports digestion, cushions joints, and helps regulate internal temperature. As people grow older, maintaining proper hydration becomes even more important. But what rarely gets discussed is how the body handles fluids differently at night, and how aging changes that process in subtle but dangerous ways. When a large amount of water is consumed in the final moments before bed, the kidneys respond immediately. Urine production increases rapidly. The bladder fills faster than it would earlier in the day. For many seniors, this leads to a sudden awakening in the middle of the night with intense urgency. The body shifts abruptly from deep rest to rapid movement in just seconds. This sudden transition places stress on the cardiovascular system. When an older adult rises quickly from a lying position, blood pressure can fall sharply. This is known as orthostatic hypotension. The drop may only last seconds, but during that brief window, blood flow to the brain can be reduced. In younger people, flexible blood vessels compensate easily. In aging vessels that are stiff and narrowed, that compensation is far less reliable. Sleep itself is also disrupted by these awakenings. Oxygen levels fluctuate. The nervous system is jolted out of its resting state. Once the person lies back down, blood pressure often rebounds higher than before. This repeated pattern of dips and surges quietly taxes the small, fragile arteries inside the brain. Clinical research has confirmed that nighttime instability in blood pressure is strongly associated with elevated stroke risk in adults over 65. The danger is not the bathroom trip alone. It is the repeated cycle of interruption, pressure change, oxygen disturbance, and recovery that slowly weakens the vascular system over time. Another hidden factor adds to the strain. While lying down, fluid naturally shifts upward in the body. In seniors with reduced circulation efficiency, this fluid can collect in the tissues around the neck and airway. Breathing becomes more restricted. Snoring and sleep-disordered breathing intensify. Oxygen levels fall in short bursts throughout the night. When sleep apnea goes undetected, this oxygen deprivation further stresses the brain and blood vessels. When all of these elements combine, a silent chain reaction unfolds.
Nightly hydration trigger awakening.
Standing causes pressure to drop. Sleep becomes fragmented. Oxygen falls.
Blood pressure surge again.
Over months and years, this cycle quietly erodes the resilience of the brain's smallest blood vessels. A stroke rarely forms in a single night. It takes shape through countless small stresses, patiently accumulating damage until one ordinary moment becomes irreversible. None of this means that older adults should reduce their overall fluid intake out of fear. On the contrary, staying properly hydrated becomes increasingly important with age. Adequate hydration helps prevent the blood from becoming overly thick, supports steady circulation, aids digestion, regulates temperature, and keeps joints functioning smoothly. What changes after 60 is not the need for water, but the body's tolerance for how and when that water is introduced. For aging systems, timing becomes just as important as volume. Physicians who regularly treat stroke patients often emphasize 3 simple hydration principles designed specifically for nighttime safety in seniors. These guidelines are not about limiting health, but about protecting the delicate balance of blood pressure, oxygen delivery, and sleep stability that the aging brain depends on. The first principle is to stop heavy fluid intake well before getting into bed. Allowing roughly 90 minutes between the last full drink and sleep gives the kidneys time to filter excess fluid before the body enters its lowest blood pressure phase of the day. When that processing happens earlier in the evening, nighttime urinary urgency decreases, and sleep becomes less fragmented. More importantly, blood pressure remains steadier across the night, reducing the sharp dips and rebounds that strain small cerebral vessels. The second principle focuses on shifting hydration earlier into the daily routine. The body uses water most efficiently during periods of movement and activity, not during prolonged rest. When hydration is concentrated in the morning and early afternoon, it supports circulation while the muscles and heart are already engaged. This improves fluid distribution and reduces the burden placed on the cardiovascular system after dark. In contrast, heavy evening hydration forces the body to regulate large fluid shifts at the very time when blood pressure is naturally lower and more sensitive to disruption. The third principle emphasizes the quality of evening fluids rather than sheer quantity. Not all drinks support safe nighttime physiology. Caffeine stimulates the nervous system and increases urine production, often leading to repeated awakenings. Alcohol alters vascular tone and interferes with normal heart rhythm during sleep. Sugary beverages disrupt insulin balance and prevent deep restorative sleep. For seniors who feel the need for evening hydration, physicians often favor small amounts of plain water with light electrolyte support earlier in the evening, which helps maintain vascular balance without overstimulating the bladder. Late-night thirst does still occur, particularly in dry environments or with certain medications. When that happens, the safest response is moderation. Small, controlled sips can relieve dryness without triggering the chain reaction caused by large volumes of fluid. This approach minimizes abrupt pressure changes while still keeping the mouth and throat comfortable enough to return to sleep. What gives these hydration strategies their real power is simplicity. They do not rely on prescriptions, devices, or complex interventions. They work in harmony with the body's natural nighttime regulation rather than forcing it to compensate for sudden internal shifts. Over weeks and months, that stability protects the small vessels inside the brain from repeated stress. The result is not only better sleep, but a quieter form of stroke prevention that operates silently, night after night, through nothing more than informed timing and restraint. Many people assume that once their eyes close and they drift into sleep, the body automatically enters a state of full recovery. For older adults, that assumption can be misleading. The way the body is positioned and the conditions of the room during sleep can quietly determine whether the brain spends the night repairing itself or enduring continued strain. One of the most underestimated risks involves sleeping completely flat on the back without any elevation of the head or upper torso. When the head rests at the same level as the heart, the return of blood from the brain relies almost entirely on the heart's pumping force rather than assistance from gravity. In younger individuals with supple blood vessels, this rarely creates a problem. In seniors, however, stiffened arteries and weakened venous valves reduce the efficiency of this return flow. As a result, pressure within the head can rise slightly during the night, placing additional stress on delicate cerebral vessels that are already vulnerable. Medical research has shown that this flat sleeping position is linked to higher nighttime intracranial pressure, particularly in older adults with high blood pressure, diabetes, or chronic inflammation. When this posture is paired with snoring or sleep-disordered breathing, the danger increases further. Breathing interruptions lead to brief drops in oxygen, followed by sharp surges in blood pressure as the body struggles to stabilize itself. Over time, this repetitive cycle quietly erodes the resilience of small blood vessels in the brain, raising the risk of both blocked and ruptured strokes. A modest adjustment in sleeping posture can significantly reduce this strain. Elevating the head and upper torso by even a small degree improves the natural drainage of blood from the brain. It also lowers airway resistance and softens fluctuations in nighttime blood pressure. Many seniors find that side sleeping further supports these benefits by improving breathing efficiency and promoting steadier oxygen levels throughout the night. There is no single perfect position for everyone, but avoiding a completely flat posture consistently reduces vascular stress during sleep. The physical environment of the bedroom also plays an important role in nighttime cardiovascular stability. Room temperature has a powerful effect on both heart rate and blood pressure regulation. Overly warm spaces cause blood vessels to dilate, increasing cardiac workload and disrupting normal pressure rhythms. Cooler environments, within a comfortable range, help maintain steadier circulation, reduce inflammation, and support deeper stages of sleep that are essential for vascular repair. Light exposure represents another quiet disruptor. The blue light emitted by modern screens interferes with the body's production of melatonin. While melatonin is widely known for regulating sleep cycles, it also serves as a natural antioxidant that protects blood vessels from oxidative damage. Suppressing this hormone leads to lighter sleep and diminishes one of the brain's built-in defenses against nighttime vascular injury. Electronic activity within the bedroom introduces additional complications. Active screens, charging devices, and wireless signals can contribute to subtle sleep fragmentation, especially in individuals who are already sensitive to disrupted sleep patterns. For this reason, many stroke recovery centers advise creating a dark, quiet, device-free sleeping environment. These adjustments may seem minor, but they shape the conditions under which the brain either stabilizes its circulation each night or continues to experience silent, repeated stress. Taken together, sleep position and bedroom environment form a powerful but often overlooked layer of stroke prevention. By supporting natural blood flow, oxygen stability, and hormonal balance, these changes help transform sleep from a period of hidden risk into a period of active protection for the aging brain. In recent years, stroke rehabilitation centers have transformed the way they approach long-term recovery and prevention. It is no longer enough to focus only on physical therapy and medication schedules during the day. Specialists now recognize that the hours spent asleep are when the brain performs much of its most critical repair work. Because of this, many clinics place heavy emphasis on structured nighttime routines that prepare the nervous system and circulation for stable, restorative sleep. One of the most widely taught practices involves gently releasing tension held in the upper body before getting into bed. The muscles of the neck and shoulders are closely linked to the nervous system and blood pressure control. When these areas remain tight, they send constant stress signals to the brain. Slow, deliberate shoulder rotations, soft side-to-side neck movements, and paced breathing help switch the body out of alert mode. This process stimulates the parasympathetic branch of the nervous system, which slows the heart rate and allows blood vessels to relax. Even a short session can reduce the likelihood of sharp blood pressure shifts after midnight. Another preventive technique used in clinical settings focuses on reversing the effects of gravity that build up throughout the day. Hours of standing and sitting allow fluid to pool in the lower extremities, increasing pressure in the legs and placing added workload on the heart. By elevating the legs slightly above heart level for several minutes before sleep, this fluid is encouraged to move back toward the core in a controlled way. This quiet redistribution supports more even circulation overnight and reduces the strain that often contributes to early morning blood pressure surges. Equally important is the way the brain is coached into entering its deepest repair phases. Many rehabilitation programs rely on consistent sensory cues to send a clear message that it is time for rest. These cues may involve a specific natural scent, a low and steady sound pattern, or a light tactile routine such as applying a calming oil or lotion. The brain thrives on patterns. When the same signal is repeated night after night, it begins to associate that input with safety and rest. Over time, this association strengthens the body's natural release of sleep-regulating hormones and shortens the transition from wakefulness into deep sleep. What makes these nightly practices especially powerful is that they operate on multiple systems at once. They calm nerve activity, stabilize blood pressure, support circulation, and promote consistent oxygen delivery to the brain. None of these effects are dramatic on their own, yet their combined influence shapes the internal environment in which fragile blood vessels either heal or continue to deteriorate. Perhaps the most striking feature of these clinic-guided rituals is their simplicity. They require no machines, no prescriptions, and no complicated schedules. They rely instead on repetition, timing, and gentle signals that the body naturally understands. When practiced consistently, they create a quiet form of protection that unfolds while consciousness fades. Night after night, They help reduce the cumulative stress placed on aging blood vessels and support the brain's ability to recover during its most vulnerable hours. Over weeks and months, these small actions can shift the balance away from silent damage and towards steady protection. In the controlled environments of stroke recovery centers, such routines are no longer seen as optional comforts. They are treated as essential tools for safeguarding the brain when it is least able to defend itself. Medications and supplements can quietly shape what happens inside the body after the lights go out. Many seniors follow strict routines with their prescriptions, yet few are ever warned that nighttime dosing changes how these substances behave. The hours of sleep alter circulation, slow the liver's processing speed, and reduce how quickly drugs are cleared from the bloodstream. When multiple substances overlap during this vulnerable window, their combined effects can place unexpected strain on the heart, lungs, and brain. Some of the most common pairings create problems that are rarely recognized. Blood pressure medications taken alongside diuretics late in the evening can drive pressure dangerously low after midnight, reducing blood flow to the brain at the very moment it depends on steady circulation. Sleep aids combined with antihistamines intensify nervous system suppression, slowing breathing and limiting oxygen delivery. Blood thinners used together with omega-3 oils or turmeric can thin the blood beyond safe margins, raising the risk of tiny, undetected brain bleeds. Certain cholesterol medications react with grapefruit extracts in a way that sharply increases drug concentration, leading to toxicity. Antidepressants paired with herbal calming agents can overstimulate or destabilize heart rhythm by amplifying neurotransmitter activity. What makes these interactions especially hazardous is not only their chemical effect, but the timing. During sleep, the body's metabolic engines downshift. The liver clears medications more slowly. The kidneys filter at a reduced pace. As a result, substances remain active far longer than expected, and overlapping effects become more intense. What feels mild when taken during the day can quietly accumulate after dark. Meanwhile, the brain is functioning under conditions of lower blood pressure, slower circulation, and reduced oxygen reserves. This is precisely when excessive drug activity becomes most dangerous. At the same time, a critical internal maintenance system depends on undisturbed sleep to function properly. Known as the brain's cleansing network, this process activates during deep stages of rest. It washes away metabolic waste, repairs microscopic vessel damage, and reduces low-grade inflammation that slowly erodes vascular integrity. This process requires long, uninterrupted sleep cycles. Each awakening fragments this repair window. Each oxygen dip weakens its efficiency. Each medication-induced disruption shortens the time available for cleanup and recovery. When the night becomes broken by repeated bathroom trips, unstable blood pressure, suppressed breathing, or chemical interference, the brain loses its opportunity to restore itself. Waste proteins remain behind.
Vaisselle walls stay inflammée.
The cumulative effect is not felt immediately, but it builds with quiet persistence. Over months and years, this unresolved stress lays the foundation for both stroke and cognitive decline. All of the adjustments discussed serve a single protective purpose. They reduce internal chaos during the hours when the brain is least able to tolerate it. Proper hydration timing limits pressure swings. Thoughtful sleep positioning supports steady circulation. A controlled bedroom environment preserves oxygen balance and hormone stability.
Bedtime ritual calme the nervous system.
Medication awareness prevents dangerous overlaps. None of these steps feels dramatic on its own, yet together they decide whether the brain repairs itself each night or continues to absorb silent injury. Stroke almost never arrives with noise in the beginning. It forms through small, repeated stresses that pass unnoticed. In the same quiet way, true prevention takes shape through small nightly choices that safeguard blood flow, preserve oxygen supply, and protect the fragile vessels that sustain thought, movement, and memory.